I was in a desperate place. I was embarrassed. I didn't want to lose my whole life. So I made the call. I called on Friday. I was in Tuesday. Everyone here, everyone I had in contact with from the Star Clinic on, were all integral in saving my life.
Right now, we're in an opioid epidemic, and the epidemic is just soaring at the moment. We have the highest number of overdose deaths that our country has ever seen, and we have a lack of providers who feel confident treating addiction.
Substance use disorder really hits every aspect of people's lives. So not only are they using substances, which is affecting their physical health, they are not getting access to the services they need because of shame, because of stigma, because of lack of access to resources due to transportation and housing. So they really get further and further and further away from any kind of health care at all.
Whenever I went around the state and met the various providers, they felt like they didn't have the support they need. They didn't have the education they need. They just didn't know what they needed to do to really support this population. And so that's really the goal here, is that we give people the power, the information that they need to feel confident treating this disorder. The North Carolina Substance Treatment and Recovery Network, also called NC STAR Network, is a hub and spoke model designed to provide addiction treatment to patients across North Carolina. The NC STAR network consists of 3 hubs, one being UNC, one being ECU, Eastern Carolina University, and one being MAHAC, which is Mountain Area Health Education Center in Asheville. And so the 3 hubs serve as educational resources and mentorship, technical assistance. And then we collaborate with the community health centers, which right now there's about 30 or 40 clinics that serve as spokes with us.
Overdose crisis is not improving, and instead the overdose rate has worsened before the pandemic and through the pandemic and doesn't seem to be peaking. So clearly there's more to be done, and the STAR network is working directly to understand why is this happening and to fill those gaps.
We need our general medical community to be educated on how to engage patients with addiction, evaluate them from a confident manner, and treat them effectively so that we can reverse this horrible cycle of addiction and death.
The hubs have 2 roles. One is to make sure that they're providing addiction treatment to those with the highest acuity treatment needs. In addition, the hubs are also a resource center for the community health centers. The hubs have the evidence-based practice and the latest information about addiction treatment.
We've developed, at this point, over a dozen different trainings, some focusing on chronic pain, some focusing on benzodiazepine use, some focused on non-clinical providers such as the nurses, the social workers, the support staff, even the front desk staff. All those individuals play a role in how a clinic approaches a patient and how a patient feels in that setting.
When we first started with the NC STAR network, we had 5 new nurse practitioners who were becoming waived to provide substance use treatment, and they were terrified. And Dr. Shukla was literally a phone call away. It was, whatever you need, and providing guidance, policies, procedures. Agape serves a very rural service area, a minimum of 30 minutes to an hour to get to a hospital sometimes. It's very hard to recruit providers to come to rural Eastern North Carolina, but we are able to serve more patients because we have access to the fellows who are trained under the guidance of UNC.
Hello, how is it going? Thanks for keeping your appointment.
They see patients remotely. They're still in Chapel Hill, and it actually gives us just that comfort of knowing that if we have a very unique or challenging situation, that we have experts that are able to assist us.
So, Joanna, my name is Verlissa, and I'm one of the behavioral health providers of the clinic.
Being a part of a hub and spoke model with the STAR Clinic absolutely helps us to focus on what we do best and helps STAR Clinic focus on what they do best. For folks who are stabilizing out of the UNC STARS Clinic who need ongoing management of their addiction, we can provide that as well as primary care. But then if folks are destabilizing and needing something that's more like wraparound, we're able to step them back up to the STAR Clinic.
Hi.
Seeing somebody go from really struggling with addiction to managing it is super inspiring because I think it's probably one of the hardest things you can ever do.
No one chooses addiction, but addiction chooses somebody every single day. No matter what group I've been with, no matter who I've been with, I ask that question. Did you wake up Monday morning saying I'm going to go get addicted? Yeah. Nobody plans that.
It just
I think people are scared of people with substance use disorders. We've really villainized them. And really, they're just folks that are struggling just like all of us. They're coping in a different way, and they're coping in a very dangerous way that could potentially kill them. So they need access to resources. They need doors to be open, not shut.
It was months and months of them caring more than I did for me to actually have that recovery switch in my brain, actually flip. I've been in recovery and clean and sober for 14 months and 1 day.
If I could speak to any other clinics that are on the cusp of what should I do, should I become a part of the NC STAR network, I would say definitely yes, a no-brainer. Just go ahead and jump feet first into it.
I have talked to several patients who have told me that without the STAR clinic or without us, that they would have died.
Addiction treatment works. We know that. As the network expands, we're now seeing that the clinics that we work with are able to expand capacity in their programs.
Opening the door and keeping it open is the goal. If you can get people in the minute they call, that could be the window that saves their lives.